Greetings, friends and followers. This is Nurses Talking, and I am Dale Barzi. And as always, if you like what you see and hear, subscribe, leave us a comment, let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. And today I have the very great pleasure of welcoming Joy Ayunla. Joy is currently out of Ohio. She's a nephrology nurse. She's a patient advocate. She's currently pursuing a master's degree as a clinical nurse consultant. She says she's committed to community health and she served in the Ministry of Health in Kenya. And she mentors through initiatives like the NCO Mentorship Academy. So, welcome, 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 Joy.
Thank you so much. I'm glad to be here.
Thanks for doing this. So first of all, tell me why you're a nurse.
Uh, so many reasons, but many people say nursing chose them. Uh, for me, it picked me long before I even understood what the scope of practice of nursing is or
Mm-hmm.
what it meant. Because growing up, I watched my mother being a nurse in her
Mm.
uniform. She used to look like a superhero without a cape. And she used to be very beautiful. I used to admire the neatness of nursing. And I also grew up in a hospital environment. That is where my mother used to work.
Okay.
So, but my real defining moment was when I lost my best friend to heart failure. She was a person I always knew she will become a nurse. Her mom was also a nurse. She was a colleague to my mom.
Mm-hmm.
She was so compassionate. And anytime we used to play, the games we used to play as children, she could take the nursing role, a
Mm-hmm.
nurse role. So I really used to know she'll be a nurse. But while she was ailing, I kind of took care of her. I used to like sitting with her and just making sure she's okay. She could share with me her challenges, her stresses, and yeah, so I think that was a real defining moment when she passed on.
Wow. Wow.
Yeah.
How old were you or were you both then?
We had just finished our high school. I was around
Mm.
uh
Yeah.
around 15 years.
Wow. A
No.
really
Yeah, I
impressionable
think
time.
around 16 years around there, yeah.
Wow.
Yeah.
Yeah. Yeah. Yeah.
Yeah. So
That's big.
we were still teenagers. And when she was sick, people used to say she's pregnant. And it's
Mm.
because people never understood what was happening. She had heart failure, she had ascites. So
Mm.
she always was very stressed about
Yeah.
yeah.
Yeah. Yeah. Yeah.
Mhm.
So you had your mother as an example
Yep.
and your friend's mother as an example.
Hmm.
And then you
Yeah.
had an opportunity to participate in the care of your friend and, you know, kind of shaped your desire to become a nurse. But when you became a nurse, when you actually became a nurse, what
Hmm.
challenged you?
Oh. Nursing, I will say I've experienced so many challenges. I don't even know where to start. Because nursing challenges are like a morning report. They never end. And nobody knows what they signed up for. Sometimes I make fun with my colleagues when they take up a shift that I knew was very crazy. I tell them, you're walking into a disaster. But anyway, there are so many challenges that I have experienced through politics,
Mhm.
nursing politics, frustration. Uh, I've
Yeah,
worked in a short-staffed environment. Sometimes you try to keep yourself awake. You
yeah.
keep praying every day that your shift becomes calm, but then it just turns to a disaster. But yeah, there are so many challenges that we keep facing, and most recent is just facing the challenge of uh, the question, is nursing a profession? Those
Well,
are really big challenge for someone who is growing, you know?
I guess it is. I guess it is. But here is the thing. My take on that is that I don't think we actually need people to tell us who we are. We know.
Sure. I
We
agree with
know.
that. We know.
So a lot of people can, I see a lot of different takes on this whole thing that you just brought up. But
Mm-hmm.
for me, we know who we are,
Mm-hmm.
and if we don't, we should.
Mm-hmm.
And probably this is one of our opportunities to show up and show out. Because, if we don't show ourselves, nobody will show us.
Yeah.
Someone else is going to try to define who we are if
I
we don't do it for ourselves. So
yeah, I agree. Actually, apart from the challenging moments, there are also, for me, my highlight, my best moments is when, even if it's one person who will just appreciate my care, it keeps
exactly.
me going.
Yeah.
I always write myself letters.
That's good
Yeah,
practice.
after a crazy shift or any time, I just feel like, okay, I think I should write myself a letter about this, or I should tell myself a story. Yeah, it's a way I
One of
try
these days,
to.
one of these days, you've got to publish these letters, Joy.
I will. I will.
So what kind of areas have you worked?
I've worked in several areas, from community healthcare nursing to medical surgical to nephrology to long-term care to ICU. I've had a chance to work in all those areas.
Yeah,
Uh,
yeah.
after school, I started on with medical surgical. Then, when I got employed by the government, I went into community health nursing. And in community health nursing, it included labor and delivery
Mm-hmm.
in rural place where there are no doctors,
Mm-hmm.
immunization clinics, HIV
Mm-hmm.
clinics,
Mm-hmm.
wellness program. And yeah, that was really a good experience for me.
So you have a wealth of experience.
Oh yeah, I do.
Um, with all of this, then, what made you choose nephrology as a specialty?
Actually, initially, I never knew what nephrology nursing is. I even didn't know that nephrology nursing exists. There's a time I wanted to change my to change my location,
Ah,
and there was a lot of politics at work, and I was like, I think I need to move. Then I just met a nutritionist on the corridors of the offices and asked me, how are you doing down there? Then I told him, no, I'm looking for a transfer. I think I need to get into a different setting of nursing. I wanted to
mhm.
go back to hospital. That's when he told me, I have an advertisement here. Maybe you can try it. And I took it and said, if this one will give me an opportunity to move, let me go for it. I applied for nephrology nursing without knowing that it exists. But again, it was interesting because I came to realize that kidney patients have some of the most honest, vulnerable conversations.
Mm,
Yeah, because uh, it's about lifestyle, fear, hope, and long-term partnership with your patients.
yeah.
So that's how I ended up in nephrology and dialysis. Yeah.
Yeah, 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 yeah. It's amazing the turns that life takes. I mean, who would know that, in a casual conversation, in a casual, unplanned meeting, your specialty exists.
Nobody could tell. I even never thought of it. I just wanted to get back to hospital setting, and that's how I
And there you
started
go.
getting into specialties. Yeah.
So,
Mm.
what do you think though?
Mhm.
Is there anything you think you would like to see change about nursing education, anything?
Oh, yeah, there are so many things I would love to see change in nursing. The culture, nurses are expected to function like superheroes, but they're not superheroes. They're just
Mm-hmm.
human beings with,
Mm-hmm.
like any other person. I would love to see more mentorship taking place for nurses. I would like to see environment where nurses feel they're valued,
Mm-hmm. Mm-hmm.
environments where nurses are psychologically safe.
Yeah, that's a
Yeah,
big one.
yeah. Respect for emotional
Yeah,
labor because
yeah.
nurses do give emotional labor.
Yes,
Mhm,
yes,
mhm.
yes,
It's
yes.
nothing is
And
not just about completing tasks. They have to talk to their patients. They have to, you know what is happening. Sometimes just that 1 minute really matters.
it matters. It
Yeah.
matters. It
Hmm.
matters. And sometimes more important than the task that you
Yeah.
completed.
True.
Yeah, yeah.
So,
You talked about it as emotional labor, and I wish that we could get across to people because they see the physical labor.
mhm,
Um, but it would be great if people could actually just get that little bit,
mhm, yeah.
you know, yeah, that there is labor there.
Hmm.
What do you see? So many things are changing, Joy.
Yeah.
What do you think you see in the next 10 years or so?
Uh, there's so much that is going to change in nursing. And like in the next decade, I see there's high chances uh, that AI is going to be of really great help in nursing. And AI will finally take over documentation. And I think this is where nurses everywhere will shout, Hallelujah! Because, uh, you know, nurses take a lot of time doing documentation
Mhm, mhm,
than
mhm.
actually being with the patients,
Yeah.
which is not the best of things. And this is all because also of staffing issues.
Mhm.
I see a decade where nurses will lead policy, research, innovations, and also integrate technology.
Yeah.
Yeah, so the aging
So
population is going to push us to rethink care models.
yes,
Yeah.
yes,
And
yes, yeah,
interdisciplinary teams will rely more in nursing judgment than ever. And nursing is not just going to be a, a backbone of healthcare, it's going to be the brain of healthcare.
the which actually I think I would like to amend that and say it's going to be recognized as the brain of healthcare because already it is.
Yep.
Already it is.
Yep.
Already it is. You talked about AI, being very, very big in the next decade or so in nursing and in
Mhm.
healthcare in general. And when I speak to nurses recently, many of them agree with that statement. But do
Mhm.
you think that we see it, but do you think we're preparing adequately for it?
No, I think we are not prepared adequately for it. But I think it's that time that we should really prepare for it. Personally, I'm trying to prepare myself for it. I got an exposure of
Hmm.
AI, and I decided to take a course on AI in healthcare. And I will tell you through that course, I've really learned a lot of things. And I'm seeing a lot of gaps that need to be covered. I'm seeing the need of nurses being prepared to handle AI. And not only nurses, even the physician and
Hmm.
the rest of the population.
Team. Hmm.
Yeah. Everybody needs to be prepared about AI because it is here. Actually, we say the future is now.
It's now. It is
Yeah.
now. And we
Mhm.
are actually trying to catch up.
Mhm. Yeah.
Yeah, it is. It is here. It is
Hmm.
here. And this fear and trembling that we have, we might as well just put it aside because we're gonna have to deal with it.
Yes.
Yeah, we're gonna have to deal with it.
Hmm.
Joy, what advice then? You've worked in different countries
Hmm.
and in so many different areas. What advice do you think you want to give someone who wants to be a nurse?
One thing I will say is if you want to be a nurse, go be a nurse. Not because someone told you it's a good career. Do it because you are ready to be stretched, humbled, inspired, exhausted, and fulfilled all in one shift. Secondly, be teachable. Be teachable because healthcare, nursing, it's changing every day. What I knew, uh, what I knew 10 years ago is not the same thing that happens today.
I know.
Something is always evolving, something is always renewed. Knowledge is always out there,
Hmm.
new knowledge
Hmm.
every time. So you have to be teachable.
Yeah,
It doesn't matter how many years of experience you have. Someone who has the first year of experience can teach you something.
absolutely.
Yeah. So be teachable, be kind to patients and to yourself. Find mentors early and do not lose your heart because it's the most valuable clinical tool for a nurse, the heart. Yeah.
That is huge. Joy. Really, that
Mhm.
is huge. And I love the be kind to yourself thing. Um, Principally, I think I love it resonates with me because just by virtue of the nature of our profession, we are conditioned. I think we're naturally wanting to, because if we weren't wanting to, we wouldn't be here. But
Mhm.
we're naturally wanting to be kind to others. And
Yeah.
then it is reinforced by our culture and environment and education and all of that. And
Mhm.
very often we leave out the be kind to ourselves part, which actually is essential if we're going to be kind to others.
Mhm.
So I'm so glad you said that.
Mhm.
So,
Mhm.
Joy,
Mm.
what is your big dream for Joy? I mean, you have done all of this. Now you want to become a clinical nurse specialist, and you're a mentor, and you believe in community health, and you're a patient advocate, and all of this. What's your big dream? Where do you see Joy?
My big dream, my dreams keep evolving every day, but
Hmm.
I've had some achievements that I keep celebrating myself. I've had chance to speak in conferences, which is I really it gave me a really good exposure. I didn't know I
Hmm.
could do it.
Hmm.
Um, my dream is to be able to function globally because for me, healthcare, the humankind is the same.
Yeah. Hmm.
They all need
Hmm.
good healthcare. They
Hmm.
all need
Yeah.
good nurses.
Hmm.
So I wish that I can live to see that time when the nursing care that is here in America is the same as the nursing care that is given in Africa. It's the same as the nursing care in Asia, That's my dream. And I think another thing, I'd love to live at a time when people are more knowledgeable to health issues. People are have access to health literatures and
Yeah.
just
Hmm.
know what they're supposed to do
Hmm.
before
Hmm.
before they get sick.
Hmm.
Because
Hmm.
I believe many of these diseases can be prevented.
Yeah. Yeah.
Yeah.
Yeah.
Mhm.
Yeah. 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 And it is, as you say, before they get sick, because we talk about um one of the things that happens is that once someone gets sick, we try to talk to them about lifestyle changes.
Mhm.
And perhaps we shouldn't be talking about lifestyle changes. We should be initially talking about just a proper lifestyle, you know, healthy lifestyles, healthy from day one,
Yeah.
you know, which, diseases are never ever going to just disappear completely.
Mhm.
But do we need to have these horrendous numbers of people who are
Mm.
suffering from these preventable illnesses? I don't think so.
Yeah. Yeah. So
Yeah,
I think
yeah,
health literacy is one of the
yeah.
most important.
Yeah, yeah, yeah.
Yeah.
And you talk about having a global view, and I love that. I love that because, as you said, health really has no boundaries. Boundaries are in our head.
Yeah.
That doesn't have any boundaries. And we need to be able to take care of people adequately, and we need to recognize what early on you talked about working in community health in areas where um you didn't have access, let us say, to a doctor,
Mhm.
and you functioned, and I think we need to recognize the um what is the word I'm looking for? Recognize that nursing itself does not necessarily, it's beyond the scope of waiting to be told what to do,
Yeah.
of waiting for a doctor's order. We have the ability to assess, to intervene,
Mhm.
to make changes to plan, all of those kinds of things. And those experiences that you had in rural communities can be very valuable and translatable into in urban settings.
Yeah. I
And
agree.
I think that's what I wanted to say in the beginning. We tend to overlook that kind of experience, which to me is of immense value.
Yeah. Because I always tell myself, I'm not a puppet. And nurses should not function as puppets. You don't just do something because you've been told to do. My professor used to say that, are you going to take vitals because it's a ritual? Do you know why you're taking the
Do you
vitals?
know why? Yes.
So
Yeah.
I don't just like the fact that I don't want nurses to be puppets. Like, no, nurses are knowledgeable. They have experience. They spend even more time with the patient. So
Than
they know
anyone
the
else.
patient, yeah, they know the patient more than the physician, than the doctor. And that's one reason we say they are the brains of healthcare, not just backbone, because the physician will rely on the information of the nurse
Yeah.
to give an order or to
Hmm.
give a
Or to make a
treatment.
decision.
Yes.
Yeah.
Yeah.
Yeah. Yeah. Yeah. Our roles are different, but they're symbiotic. So, Joy, one more
Mhm.
thing. We're talking a lot these days about self-care. And so I want to know what self-care means to you. What do you do to care for you?
For me, self-care for me is permission to rest. It's permission to cry, to sleep, to laugh, to switch off my phone if I want to. And to say, no, not today. I'm not working. I'm not breaking my back, or I'm not.
Mm-hmm. Mm-hmm.
Sometimes self-care is just a long nap. Sometimes it's prayer. Sometimes it's doing absolutely nothing, just feeling
Yep.
lazy and, just taking care of yourself without having any guilt.
Exactly.
Yeah.
Exactly.
And uh, I think it's important to realize that there are things that we need to do to take care of ourselves. We
Yeah.
need to exercise, despite the fact you'll walk for 12 hours. Yeah, that is not enough exercise. Take time to exercise. It is really, really healthy. That is self-care. If you can do yoga, do yoga. It's self-care. Meditation, it's self-care because these are ways that make you go back to yourself. Like,
Yep.
yeah.
Yep.
Mm-hmm.
Mm-hmm. Yeah. Mm-hmm.
Yeah.
I love that you said it's permission. I actually never thought of it as permission. I think in terms of, boundaries and all of that kind of thing, but permission. I give myself permission to do or not do. I love that.
Mm-hmm.
Yes. Yes.
Sometimes we are just too hard on ourselves. Permit
Yes.
yourself to be just something else.
Mm-hmm. Mm-hmm.
You only
Mm-hmm.
have one life to live. Nobody else is going to give you permission for yourself. You have to give yourself
You
permission.
have to give yourself permission. You have to give yourself permission.
Yeah.
And do whatever it is that makes you feel like you. As long as it doesn't hurt anyone. So one of the things that I do, honestly, that just really makes me feel like me. I have a refrigerator in my kitchen that's continuously going.
Mhm.
And very often that's where I dance in my kitchen.
Mhm.
Just wild, just wild dancing, right? But I love it. Is one of the things that really lights up my day, to tell you the truth.
Mhm. I do
Yeah.
that a lot myself also. Like
Hmm.
I think music keeps me going, dancing keeps me going. Many a times I tell myself before I go to work, before I clock in, I have to do I have to motivate myself.
Hmm.
It just changes
Yeah,
the mood.
it
Because
changes everything.
yes, yes,
It
yes. So,
changes everything.
yeah.
Joy, thank you so, so much for this conversation. You lit up my morning.
You're welcome. I'm happy to do it.
Are there any last words you'd like to leave us with?
One thing I want to say to every nurse, maybe whoever is watching this, honestly, nursing is not easy, but you can make it easy. Just take one day at a time. Love yourself. Only if you love yourself, you can love the other person.
Yeah.
The cruelty in that workplace or whatever you might meet is there. You'll never run away from it. And
Mhm.
always know that my teacher taught me that the patient is my boss. That patient is sick. You are the one who is well. So sometimes when they throw tantrums and everything, just know that you are the one who is well and they are sick and you're there to help them.
Okay. Mhm.
That is how I keep uh, reminding myself so that I don't feel bad. So
Mhm. Mhm. Yep. Yep.
yeah, you
Yeah.
just remind yourself that I'm here to
Yeah.
help.
Yeah.
Yeah.
Yeah. Yeah. Joy, thank you so much for that. That's a good note to end on. That's a good note to end on. They're sick, you're well. You're here to help them.
Hmm.
And friends and followers, I am Dale Barcy, and this has been Nurses Talking.